Alright, so today let's talk about the monoamine oxidase inhibitor. I already explained that there are four main class of drug for anti-depression. We said we have the monoamine oxidase inhibitor, we have the tricyclic antidepressant, we have the selective serotonin reuptake inhibitors, and lastly we have the atypical antidepressants. Okay, now all these ones, they are majorly based on the amine theory. Remember we said there are three theories as it relates to depression. Okay, so today now we want to focus on this monoamine oxidase inhibitor. We already said that monoamine oxidase is an enzyme. Okay, MAO is an enzyme that what will this enzyme do? It will take a monoamine and convert it to what? To, let me say, breakdown product. Okay, meaning it will break down monoamine like what? Like norepinephrine, like what? Like serotonin. Okay, so it destroys them. So if we can inhibit this enzyme, it means that we are going to raise the levels of norepinephrine, serotonin, dopamine also. I get my point. So all these ones are your monoamine. If you can inhibit this monoamine oxidase enzyme, MAO enzyme, monoamine oxidase enzyme, then it means that you have solved the problem of depression. Okay, now this monoamine oxidase enzyme, where are they located? They are located in the outer mitochondrial membrane, to be specific. Outer mitochondrial membrane. In the outer mitochondrial membrane, that's where you see them. And basically there are two types of monoamine oxidase enzyme. We have the MAO, so I will just take a table. We have MAO, and we also have MAO. So A for all, it means that it is found in all tissues, majority of the tissues, particularly your gut, your GIT, your liver. Okay, that's where you see MAO. This one, it is located more in the brain, so in the CNS, more in the brain. Also, MAO enzyme is also seen in platelets. Okay, also seen in platelets. Now, in terms of the substrate they act upon, this one was based on their location. Okay, this one was based on their location. In terms of substrate wise, which substrate they act upon, MAO majorly act on norep and serotonin. Those are the ones it act upon. MAO is more on dopamine. Okay, more on dopamine. Did you get my point? MAO is more when we are dealing with Parkinson. That's where we usually talk about MAO. Okay, but for this depression, we'll be focusing more on MAO. Are you there with me? Okay, so MAO is found in all tissues, particularly the gut, the liver, and every other tissue. MAO is more in the brain. You can also see it in platelets, but to be specific, more in the brain. MAO can act on norepinephrine and serotonin, while MAO act more on dopamine. Although MAO can also act on dopamine, but for simplicity's sake, let's leave it like this. Alright, so the MAO inhibitors class of medication, they are now divided into three. So let's say I'm saying something like this: MAO inhibitors, the drug that are here, and also say they are divided into three. The first one is what we now call the non-selective MAO inhibitor. While there's one that is specific for MAO, and that one is specific for MAO. Are you there with me? So non-selective, specific, selective for MAO, selective for MAO. Now, This one that are non-selective, they usually the way they bind is that they bind irreversibly. They bind irreversibly. Are you there with me? They bind irreversibly. So whenever they bind to the enzyme, their effect usually lasts for like 2 days. So it takes time. Why this MAO A, this one that specifically inhibit MAO A, they bind reversibly. So the effect can be reversed, let's say in 2 hours or so. MAO B, like I said, is more for Parkinson. That's where you see your selegiline, as we will talk about later on. Okay, so and one thing you need to understand about these MAO inhibitors is that they are not your first line drug for treatment of depression. They are not a first line drug. Your first line drug are usually your SSRIs slash atypical antidepressant before you now think of your second line, which are your tricyclic antidepressants. Okay, then your third line is these MAO inhibitors. So the only time you hear they are using MAO inhibitors is usually for refractory depression. So for refractory depression, that is depression that you've used SSRI to treat, you've used atypical to treat. I get my point. You've even tried tricyclic antidepressant before you now think of MAO inhibitors as a drug for depression. So they're usually for refractory depression. So they have a lot. The reason why they are not first line basically is that they have a lot of side effects, as we will see shortly. But before we go into those side effects, let's give example of drug under each of these class. Let's give example of drug under this class. Let's say this non-selective MAO inhibitors. There are two main drugs there. We have our phenexine. So we have under this, let's say I will put A for the first class, the non-selective MAO inhibitors. Here we have your phenexine. Then we also have your tricyclomine. So these are the two medication that are under this your non-selective MAO inhibitors: phenexine, tricyclomine. Are you there with me? Okay, so basically I already explained that this medication, that we have a lot of side effects, and their side effect is that they usually cause what we call that is, they have the ability to react with that what we call drug food interaction, and not only them, the entire class, they have drug food interaction. Also they also show what we call drug interaction. Are you there with me? Okay, so phenexine, tricyclomine, these are your drugs under non-selective MAO inhibitors. I made mention that they bind irreversibly, so they will have a lot of that Schiz reaction, which we will talk about here, this drug food interaction. So they will show a lot of the Schiz reaction. Schiz reaction is what you get from the drug food interaction. Why from your drug interaction, what you usually see is your hypertensive crisis, which is something that let me not call it Schiz reaction, but you have risk of hypertension, because this Schiz reaction is particular to drug food interaction. Why effect you will see from drug interaction are hypertension alongside with serotonin syndrome. We'll discuss them later on, but for now just believe me that the monoamine oxidase inhibitors, the reason why they are not being used basically is because of these two things. They have been shown to show high levels of drug food interaction alongside with high levels of drug interaction. So these are the things they display. That's why they're not used well. So they are third line drugs for depression. Okay, So let's explain this sheath reaction in a more better way. This sheath reaction basically is more like hypertension that we see. It's more like hypertension that we see when we give patients these MAO inhibitors. Okay, so it's a sudden rise in blood pressure on eating cheese alongside with a MAO inhibitor. When you take a MAO inhibitor,